About 79 million Americans are currently infected with HPV, and about 14 million people become infected each year. Dr. Sandra Bender at Desert Regional Medical Center in Palm Springs discusses the treatment and prevention.
HPV stands for human papillomavirus, and it is there's probably at least 100 strains of human papillomavirus. There are about 40 or 50, though, that can cause some significant health issues. In particular, strains 16 and 18 can cause cervical cancer in women and has also been found to be a predisposing factor in penile cancer, vulvar cancer, vaginal cancer, and most recently oral pharyngeal cancer, the back of the throat and the mouth. Strains 6 and 11 are also known to cause genital warts, which can also be found sometimes in the mouth.
Dr. Bender discusses the symptoms of HPV.
Unless you see the warts, which is the most common outward sign of the virus, or you as a female have a pap smear that comes back abnormal and is tested for HPV, you really have no idea that you're a carrier. I think in June of 2006, the FDA approved a vaccine to be given to young adults hopefully prior to sexual activity, to prevent them contracting both, I should say all 4 strains of 6, 11, 16, and 18, although there's 2 vaccines out. There's one other that only covers 16 and 18. And in the hopes of preventing them from getting the virus and thus it leading to potential cancer changes.
How is HPV diagnosed?
Currently, the only way that it is diagnosed is via a test on pap smears on females. There's no test currently to preventatively check a man or a woman for it if it's in the mouth or just on the skin in the genital area. Thus, the reason for our strong push to get this preventative vaccine to avoid, basically getting cancer. If you present to me with genital warts, they can be removed. There's several techniques that can be cut off, they can be burned off, liquid nitrogen can be used. Certainly if warts or a cancer is found in the mouth or the back of the throat, that of course would require a specialist and probably an extensive surgery. If it presents in a female, an abnormal pap smear that's HPV positive, the next step for that woman would be to proceed to a procedure we call a colposcopy to assess how much of the cervix is affected by the virus, or has the virus already changed the cells to cancerous, in which case there is another procedure called a LEEP, where basically they kind of cut out or burn off the areas that are cancerous, and just similar to kind of any other cancer, you then monitor more frequently with pap smears to make sure that you've gotten all the bad cells.
Who is more susceptible to getting HPV?
The demographics show that because it is a skin-to-skin contact disease, it is most prevalent found in young adults, 18 to 29, which is why the target for getting this vaccine is 11 to 13 for boys and girls, to try to get them before they've become sexually active, to prevent them from becoming a carrier. As I mentioned previously, you don't have any symptoms. A man and a woman who are in a monogamous relationship and no outward symptoms, the man can give the virus to the female, who then doesn't find out she has it until perhaps years later. It can lie dormant for a long time, and then she develops an abnormal pap smear and the HPV is found.